Assalamualaikum and good afternoon. Today, our group will be presenting on the Movement Control Order (MCO) policy.
Health policy is what the government plans and does to protect people's health and make sure everyone can access healthcare safely. It's especially important during situations like a pandemic where quick and clear actions are needed. One example is Malaysia's Movement Control Order or MCO, which started in March 2020 during COVID-19. This government introduced things like movement restrictions, closing non-essential businesses, and social distancing to control the spread. This affected people's daily lives a lot, like switching to online classes and working from home. And it also impacted the economy. But at the same time, it helped reduce the number of COVID-19 cases and gave the healthcare system time to prepare.
Next, policy problem. Before the movement control order was implemented, one of the biggest problems in Malaysia was the rapid spread of COVID-19. At that time, there were no movement restrictions, so people continued their normal daily activities such as working, traveling, attending events, and gathering in large groups. Because of this, the virus spread easily from one person to another, especially in crowded places. In March 2020, Malaysia experienced a sharp increase in daily cases. This was mainly due to mass gathering where one infected person could spread the virus to many others. So, for the example, a large religious gathering became one of the biggest infection clusters. Evidence showed that cases increased from double digits to 100 in a short time, which clearly show how fast the virus spread. At the same time, healthcare workers such as doctors, nurses were under a lot of pressure. They had to work long hours with protective equipment for long periods and deal with emotional stress from seeing many serious cases and deaths. This also increased the risk of burnout and mistake. Evidence showed that the number of patients was increasing faster than what hospital could handle. If the situation continued, the healthcare system would not be able to cope and some patients might not receive proper treatment. Another major issue was the pressure on the healthcare system. As COVID-19 cases increased, more people needed medical care. Some patients had made system, but many became seriously ill and required treatment in intensive care units. Hospitals started to experience shortage of ICU beds, ventilators, and important medical supplies. It is because resources were limited, hospitals had to prioritize the most serious patients, which made the situation more stressful. Next, COVID-19 also created a serious risk to public health. It affected people differently, but it was more dangerous for elderly individuals and those with existing health conditions such as diabetes, heart disease, and respiratory problems. As infection increased, more people experienced several symptoms. Some had difficulty breathing and needed oxygen support, while others had to be admitted to the ICU. At the same time, that cases also increased. This situation will cause fear and anxiety among the public, as people were worried about their own safety and their families. The virus also spread easily during daily activities like working, shopping, and social lives. In addition, some people could spread the virus even without showing any symptoms. This made it harder to control the spread and increase the risk for vulnerable groups. Without proper control, the number of several cases and deaths will continue to rise. Okay, so for the last major issue at the early stage of the pandemic was the lack of medical solution. At that time, there was no vaccine and no specific treatment available for COVID-19. Doctors could only provide supportive care such as oxygen and managing symptoms, but they could not fully cure the virus. This created uncertainty for both patients and healthcare workers. Because of this, prevention became the main way to control the spread. People were encouraged to practice social distancing, wear masks, and also limit your travel. However, many people did not follow this guideline consistently, and there was also confusion about how the virus spread. Evidence from international health organizations showed that countries that delay action experienced higher infection and death rates. Therefore, it became necessary for Malaysia to implement a strict policy like the MCO to reduce movement, limit social interaction, and control the spread of the virus.
The MCO was implemented with several key objectives. First, it aims to reduce the spread of COVID-19 by limiting human interaction. Since the virus spreads easily when people are in close contact, restricting movement and gatherings helps break the chain of infection and lowers the number of new cases. Second, the MCO helps to flatten the curve. This means slowing down the increase in cases so that hospitals don't become overwhelmed. If too many people get affected at the same time, there would not be enough beds, equipment, or healthcare workers to treat everyone properly. Third, it focused on protecting vulnerable groups, especially the elderly and those with existing health conditions. These groups are more likely to experience several symptoms, so reducing overall cases also helps protect them from exposure. Lastly, the MCO gives time for healthcare systems to prepare. This includes increasing hospital capacity, providing enough medical supplies, and ensuring healthcare workers are ready to handle more patients.
Today, I will present about the strategies in implementing the Movement Control Order or MCO in Malaysia during COVID-19. The MCO was introduced to control the rapid spread of the virus and protect public health. There are four main strategies used. The first strategy is movement restriction. The government enforced strict stay-at-home rules where people were only allowed to go out for essential purposes such as buying food, seeking medical care, or working in essential sector. Travel between states and districts was also restricted, and roadblocks were set up nationwide. According to reports, mobility dropped significantly with visits to public places decreased by more than 60%. This helped reduce physical contact between people and successfully slow down the spread of COVID-19. The second strategy is closure of non-essential sectors. Businesses like shopping malls, gyms, cinemas, and schools were temporarily closed. Education shift to online learning. Only essential sectors such as healthcare, food supply, and utilities were allowed to operate. This reduced crowding in public places and minimized of high-risk interaction. As a result, fewer clusters were formed and the number of COVID-19 cases began to stabilize. Other than that, the third strategy is enforcement by authorities. The government involved the police and the army to ensure the people follow the rules. Roadblocks, patrols, and monitoring were carried out across the country. Thus, who violate the SOPs will face fine or will take legal action. Thousands of penalties were issued during the yearly phase, showing the strict enforcement. This strong enforcement increased public awareness and improved compliance, which is help control the spread of the virus. The final strategy is public health measures. The government introduced SOPs such as wearing face masks, practice social distancing, and frequent hand washing. Public places were required to provide hand sanitizer and limit the number of people inside. Temperature checks were also conducted and digital tools like My Sejahtera were used for contact tracing.
Next, I'll be presenting the policy evaluation of the Movement Control Order or MCO in Malaysia. And I'll be focusing on the strengths of this policy and how it helped manage the COVID-19 situation. The first strength is that the MCO was effective in reducing COVID-19 transmission. At the early stage of the pandemic, Malaysia experienced a rapid increase in cases, mainly due to mass gatherings and close contact between people. When the MCO was introduced, movement was restricted, public places were closed, and gatherings were banned. This helped reduce social interaction, which is the main way the virus spreads. From the data, we know that the reproduction number, or RT, dropped from more than 2.0 to below 1.0. This means the spread of the virus was under control. In fact, studies show that the transmission rate dropped by more than 50%, which prove that the MCO was effective in flattening the curve. The second strength is that the MCO helped prevent the healthcare system from being overloaded. In many countries, hospitals became overwhelmed because too many patients needed treatment at the same time. However, in Malaysia, the MCO slowed down the number of cases, so infections were spread out over time instead of increasing suddenly. This is known as flattening the curve. Because of this, hospitals were able to manage patients more effectively and provide better care. Studies also show that movement restrictions can reduce peak cases by up to 90%. At the same time, the government used this period to prepare more ICU beds, PPE, and quarantine facilities. So the third strength is increased public awareness and behavioral change. Before COVID-19, practices like wearing masks and social distancing were not common in Malaysia. During the MCO, the government carried out daily campaigns and briefings to educate the public about the virus and how to stay safe. As a result, people became more aware and responsible. Studies show that more than 80% of Malaysians follow SOPs such as wearing masks, washing hands, and avoiding crowded places. At the same time, mobility data shows that people reduced their visits to public places, which means they were following the rules. These changes are important because they help reduce the spread of the virus and also created long-term healthy habits. The fourth strength is the strong and coordinated government response. Malaysia implemented the MCO early on 18 March 2020, which helped control the spread before the situation became worse. The government also worked closely with the police and military to enforce the rules. Roadblocks were set up and fines were given to those who did not follow SOPs. This strict enforcement helped increase public compliance. In addition, the government used a phased approach starting from MCO, then CMCO and RMCO. This allowed flexibility depending on the situation, which made the policy more effective.
Next, the weaknesses of the Movement Control Order, MCO. Although the MCO was effective in controlling COVID-19, it also created several negative impacts. There are 4 weaknesses, which are economic impact, mental health issue, complaints issue, and impact on education. The first weakness is the economic impact. The implementation of the MCO, it caused major disruption to the Malaysian economy. This is because many businesses were forced to close or reduce their operation. And then small and medium-sized enterprise, or also we known as SME, were the most affected because they did not have enough financial resources to survive long-term shutdown. Sectors such as tourists, retail, and hospitality face large loss due to travel restriction and few customers. As a result, many businesses had to reduce salary, short working hours, or lay off employees. The second weakness is mental health issue. During the MCO, many people experience stress, anxiety, and emotional problems due to the long period of isolation and uncertainty. Staying at home for a long time reduces social interaction and disrupt daily routine, which negatively affect mental health. Many people also feel worried about getting infected, losing their job, and facing financial difficulties. A
According to the World Health Organization, there was a 25% increase in anxiety and depression cases globally during the pandemic. Next is compliance issue. Even though strict rules were implemented, but not all people follow the standard operating procedure (SOP). Some individuals continue to travel or gather without valid reason, which this can increase the risk of virus transmission and cause new infection cluster. The last weakness is impact on education. During the MCO, as we know, school and university were closed and students were required to switch to online learning. However, not all students had access to proper devices such as laptop or stable internet connection, especially those living in rural or low-income area. And then some students had to share their device with their sibling. It's making difficult to attend their class regularly. This is because they only have one device, and not just students but also teachers face challenge using digital teaching platform. As a result, students had difficult to focus and their motivation also can decrease.
Next, I'll be presenting about recommendations for MCO. First, the government needs to strengthen economic support, especially for SMEs. SMEs are very important because they provide a large number of jobs and contribute a big portion to Malaysia's economy. During MCO, many of these businesses lost income and some had to close. So instead of giving financial aid to all businesses, the government should focus on those that are most affected, like tourism, retail, and hospitality. Support can be given through wage subsidies, low interest loans, rental assistance, and tax relief. Next, instead of having a full nationwide lockdown, a more flexible approach should be used. For example, only high-risk areas should have strict restrictions, while low-risk areas can continue business operations with proper SOPs. This helps reduce economic losses while still controlling the virus. Besides that, digitalization is very important. Many SMEs struggle because they depended on physical stores. If businesses are supported with digital tools, online platforms, and training, they can continue operating even during restrictions. Lastly, social protection must be improved. During MCO, unemployment, so the government should provide unemployment benefits and training programs to help people find new jobs.
Next, strengthen policy compliance through clear communication, consistent enforcement, and behavior-based strategies. Okay, first, the government should provide clear and consistent information regarding the SOP and regulation. During MCO, frequent change cause confusion among the public. Therefore, rules should be simple, updated regularly, and shared through TV, social media such as Instagram, TikTok, and also official platform. Second, enforcement must be consistent and fair in every area. If rules are applied differently, people may lose trust and become less cooperative. Third, the government can use behavioral strategies. For example, reminder through mobile app, poster in public place, and message such as most Malaysians follow SOP can encourage people to follow rules voluntarily. Okay, lastly, community leader and local organization should also help spread awareness because people usually trust individuals close to them. Compliance can be improved not only through punishment but also through trust, education, and cooperation. Strengthen digital education, equity, and teacher preparedness. Next is recommendation which focus on improving education during movement restrictions. First, the government should ensure all students have access to device and stable internet condition, especially for students from rural and low-income families. During MCO, many students were left behind because they could not join online class. Second, teachers should receive continuous training in digital teaching skill. Many teachers face challenge using online platform for the first time. Third, the education system should apply a hybrid learning method which combine online and face-to-face learning. This is more effective, especially for practical subjects.
In conclusion, the MCO was an effective strategy in controlling COVID-19 and increasing physical distancing among people. It helped reduce the transmission rate through improved preparedness and response time of healthcare providers. Without this reduction, the healthcare system might have experienced a total breakdown due to high number of hospitalized patients. Although the MCO was a restrictive measure, it was still beneficial in promoting good public health and reducing the number of new cases, especially during the early phase of the pandemic. However, the MCO also brought several negative impacts. Many companies had to shut down or experience significant loss of revenue, which led to unemployment and financial hardships. Students also face difficulties in online learning due to lack of proper equipment and internet connectivity. In addition, staying indoors for a long period affected people's mental health, causing stress, isolation, and uncertainty about the future. Overall, while the MCO was effective in managing the pandemic, it also had a number of negative consequences that need to be considered. It remains a valid and efficient option, but there is still room for improvement in the future actions.
I just had to let you know you're